Rhode Island is the smallest state in all the land, but it has a very big COVID problem. The state's positivity rate now stands at 5.9%. Cases quickly turning to hospitalizations. ICU beds are almost full, 85% occupied statewide. Laura Forman now. Laura is the chief of emergency medicine at Kent Hospital in Rhode Island. Doctor, thanks for being here.
Thank you for having me, Shepard. I appreciate it.
We know hospitals are struggling to keep up now, but if you could look ahead to Thanksgiving and give us an idea of what you're expecting then.
We're really concerned about it. I mean, as you noted, our ICU beds are nearly full in the state. Our emergency departments are full. Our hospitals are rapidly filling up. And this pandemic really has pushed us right to the brink. We are an incredibly well-resourced state here in Rhode Island when it comes to our healthcare needs, but we are rapidly running out of room. And we're very concerned with Thanksgiving coming if we continue on this trajectory that we will be overflowing hospital capacity in the very near future. You know, we've seen a lot of people in small groups getting together. We've seen a lot of people coming together with members outside of their household. We're concerned that Thanksgiving could become a massive super spreader event and push us out of the hospitals into our field hospitals here.
You've worked at hospitals all over the world in all kinds of situations for decades now. And I wonder what you see now, to what would you compare it from your experiences?
You know, I've worked in emergency medicine for over 20 years, and I've worked around the globe in refugee camps and in war zones and field hospitals. What we're seeing now, what we've seen in Rhode Island these past months is unlike anything I've seen in 20 years of medicine in the U.S. It's much closer to that which I've seen in field hospitals and under-resourced settings. We are running out of space here. We are running out of the ability to care for people in the traditional hospitals that we have. And we're very concerned that we will be in field hospitals soon, working with fewer resources and fewer staff and in conditions that we're not used to working in, quite frankly.
You know, I'm not sure people really understand that there may come a day when they have a heart attack or have a car wreck or fall and break a leg on ice, and they won't have anywhere to go. That's a real thing, isn't it?
It is. You know, we're very lucky in this country that we have so many healthcare resources and we have such incredible hospitals and such incredible training. And I think we do take it for granted, but we have finite resources. There are only so many doctors in this country. There are only so many nurses. There are only so many hospital beds. There are only so many ventilators. And we're really at risk of running out of those. You know, our cases are increasing so rapidly here. We literally today are making plans to put refrigerated trucks for morgue space outside of our hospitals and field hospitals. I mean, this is something unlike what we've seen in this country before, and I'm worried about it. And the toll that this is taking on healthcare workers is tremendous. I know you had a brief clip about that before. You know, healthcare workers in this country are getting sick because of the rate of community spread. We're being incredibly careful in our hospitals with PPE and taking care of to protect ourselves and one another and our patients. But healthcare workers are still getting sick with COVID. And one of our biggest concerns is that we will have too many staff out sick and be unable to staff some of our hospitals in the near future.
Dr. Laura Forman, it's a sobering reality. All the best to you and yours, our heroes all. Thank you very much. Shepard Smith here. Thanks for watching CNBC on YouTube.